The doctor becomes a patient.
I looked at the pathology reports myself and I said, this doesn't look good.
Facing the pain of terminal cancer, Dr. Roger Kliegler wants a choice.
Being allowed to decide when enough is enough, it just provides a lot of relief.
But some colleagues say a right to choice is wrong.
They should have faith in us as healers, not as executioners.
Now, Kliegler takes his case to court.
Do you hope or think that the lawsuit will be resolved in time for you?
A fight to the end. His last right. Next on Chronicle. Good evening. Massachusetts is considered one of the most progressive states in the country. But advocates say that is not the case when it comes to our so-called right to die laws. A Cape Cod doctor learned this for himself the hard way. Dr. Roger Kliegler, now retired, was a primary care physician for 30 years. During that time, patients relied on his care for routine visits, complicated diagnoses, and worse, death.
I've dealt with this with a lot of people. I've worked in intensive care units. I've seen people die more ways than you can think of. And I've helped people, and it's something that I enjoy doing for people, which is just talking to them, helping them to live their lives.
Now, Kliegler is dealing with his most challenging patient, himself. 15 years ago, he was shocked when his own prostate screening test came back positive.
I ordered it myself. I went down to the lab, I got the result, and I said, oops, there's a problem here. So I called up my friendly urologist, and he said, well, come on in and we'll do a biopsy.
Like all patients, a hopeful Kliegler waited for the results.
And in one little corner, 5%, there was a small piece of cancer.
The professional in Kliegler took the diagnosis in stride.
I went up to Mass General, had a prostatectomy, and you're cured.
Kliegler also knew there would be no guarantees. Along with his wife Kathy and their 3 children, he hoped for the best possible outcome.
I looked at the pathology, reports myself, and I said, this doesn't look good. I was concerned at the time about what I saw. They looked at the cancer and how aggressive it is, and they mark it really aggressive, super bad stuff is a 5. And I had a 4. You start getting into the 4s, that's troublesome.
First, Kliegler had surgery to remove his prostate, then a course of radiation, followed by hormone therapy, then a cornucopia of drugs to relieve the side effects, all the while taking a dose of his own medicine.
I wasn't afraid of dealing with people who were dying, and one of the things I'd always say is that you're not dead yet. You need to keep living. You're going to die. You've known that for, all your life just about, but you need to keep living and to try and help people that way.
After years of treatments, Kliegler has run out of options, and the pain has worsened. Today, the doctor who counseled so many dying patients is facing his own mortality, and he knows death is imminent.
So my mother died of pancreatic cancer 10 years before I was diagnosed. My father-in-law died of sarcoma. So I watched the 2 of them die, and neither were very pretty. They're not comfortable deaths. At that point in time, I decided that, I would not want to die that way.
Instead, Kliegler wants to end his life on his own terms, but that is against state law. So this dying doctor hopes to change the rules. He filed suit against Cape and Islands DA Michael O'Keefe and Attorney General Maura Healey to prevent authorities from prosecuting doctors who prescribed fatal doses of sleeping pills to terminally ill patients who request them. Dr. Alan Steinbach has joined in the lawsuit.
Dr. Kliegler actually has metastatic prostate cancer, and that's going to lead to a lot, predictably, pain and suffering. And he personally, not just as a physician, but personally, wants to know that a doctor that helped him by prescribing aid in dying would not be prosecuted. So we want clarification. And the judge is considering right now whether that's a reasonable request.
Kliegler is haunted by the memory of the last patient who asked him for help in dying.
I kind of have his face in my mind when I'm dealing with these issues. It's, you know, it was his life, his suffering, and
You couldn't help him in the way.
I feel guilty. I feel guilty that I didn't do what's right by him.
As you heard, Dr. Kliegler's lawsuit seeks to define whether a doctor who prescribes medication that enables a patient to die with dignity could or would be prosecuted. Both the Attorney General and the Cape Cod District Attorney had no comment on our story tonight. The lawsuit is currently before a judge. Up next, hear from a woman who moved to Oregon for that state's death with dignity law.
The thoughts that go through your mind when you find out you have so little time is everything that you need to say to everyone that you love.
Medical assistance for dying patients reached national attention in 2014 when 29-year-old Brittany Maynard of Alamo, California, was diagnosed with a glioblastoma, stage 4 brain cancer. She was told she had 6 months to live. Her story went viral.
After getting married is when I first started experiencing the headaches, and they were quite severe. And I didn't understand them because I had never had anything like that before in my life.
Unfortunately, Maynard's symptoms only worsened.
My most terrifying set of seizures, I had 2 in a day, which is unusual. And I remember looking at my husband's face at one point and thinking, I know this is my husband, but I can't say his name. And ended up going to the hospital for that one.
As Maynard suffered, she and her husband Dan made a choice. They moved to Oregon for its death with dignity law. She met the state's strict criteria and filled the prescription.
I don't wake up every day and look at it. It's in a safe spot, and I know that it's there when I need it. And I will die upstairs in my bedroom that I share with my husband, with my mother and my husband by my side, and pass peacefully with some music that I like in the background.
Between suffering or being allowed to decide when enough is enough, it just provides a lot of relief and comfort that, okay, that option is there.
I can't even tell you the amount of relief that it provides me to know that I don't have to die the way that it's been described to me that my brain tumor would take me on its own. I hope to enjoy however many days I have left on this beautiful earth and spend as much of it outside as I can.
With her husband by her side, Brittany Maynard passed away November 1st of 2014. Ironically, California, the state Brittany Maynard moved from, passed the End-of-Life Option Act a year later. Currently, along with Oregon, California, Montana, Vermont, Washington, Colorado, and the District of Columbia have authorized medical aid in dying. Together, these locations make up 18% of the U.S. population. Janet Folger's husband, Dave, passed away in April 2017. The Falmouth resident had been diagnosed with pancreatic cancer just 5 months earlier.
He wasn't feeling good. He was just writhing in pain. We were trying to play music for him, whatever we could think of to get him comfortable. This guy never complained about anything. He was Mr. Stoic. Honey, he said, I can't take this anymore. I can't take this anymore. To see him curled up in a fetal position, crying, I can't take this anymore. Yeah, it was bad.
Looking for relief, Janet and Dave discussed moving to Vermont.
That night I got right on it, and I think the getting residency would have been easy. The more difficult part was, one, just moving him up there because he was so uncomfortable. But even harder, you have to find doctors who would be able to evaluate him and give him the 6-month or less diagnosis and say that he was mentally competent.
The process would have been difficult and expensive, nearly impossible for the Folgers.
Having that choice in Massachusetts, having that law in place, medical aid in dying, certainly for our family, and I'm not making any judgment on any other family who might need or choose something different, but for us, it would have been a wonderful option.
But what would have been a relief for the Folgers is to others suicide, even murder. And we'll get to that later in the program. It is, though, important to note that states which allow death with dignity have strict legal regulations requiring that individuals must be 18 years of age or older and a resident of that state. They must be mentally competent and diagnosed with a terminal illness that will, within reasonable medical judgment, lead to death within 6 months. They must also be able to self-administer and ingest the prescribed medication. And 2 physicians must determine whether all these criteria have been met. Up next, Beacon Hill considers a death with dignity bill. This doctor is against it.
We should be treating our patients in the proper way, not advocating physician-assisted suicide.
End-of-life care is among the most controversial debates of our time. On both sides, passions run high. Some are against death with dignity for religious reasons. Others say it's unethical, that protecting life is paramount. On the other side are those who believe terminal patients should be given the right to choose how they want to die. Former president of the Massachusetts Medical Society is Surgeon Barbara Rocket, a staunch opponent of any kind of aid in dying.
I'm curious a little bit about your position and how you've gotten there on this issue.
We should be treating our patients in the proper way, not advocating physician-assisted suicide. And how do we treat them properly? If they have pain, we treat their pain. If they have depression, we treat that. We have them referred for hospice or palliative care. They should have faith in us as healers, not as executioners.
Proponents of medical aid in dying, Compassion and Choices, an advocacy group. Working for their cause is campaign manager Marie Manis.
In 2012, people weren't even talking about death, never mind aid in dying or death with dignity, as it's also known. Over the years, and especially after the Brittany Menard case, people just opened their eyes and just started seeing that this is something we should have.
Compassion and Choices succeeded in getting a vote for death with dignity on the 2012 state ballot.
In 2012, if I recall, there was 64% and 68% support across the state. And the last 3 weeks of the campaign, the opposition put in loads of money into the airwaves.
In the end, the question was voted down.
People got scared. Still, there was such a small margin, which is why we took it up legislatively.
I thought it was a slam dunk that there's no way that Massachusetts would not vote for it. So while I'm politically active, I didn't do anything for it, and I'm ashamed to say that.
Compassion and Choices recently introduced what they believe is a stronger bill.
In fact, we have 2 sponsors on our bill. We have the House sponsor, Representative Lou Kafka, and we have a bill in the Senate as well, and that's Senator Barbara LaTallian.
John Kelly is with Not Dead Yet. He worked to defeat the vote 5 years ago and opposes the new bill.
A lot of people think that people like me are better off dead, that our quality of life meant that we should be given the choice of killing ourselves. What happens is that these laws inevitably take choice away from people, and they end up having innocent people losing their lives through mistakes, abuse, the bottom line of insurers, and treatable depression.
But attorney Charles Barron, BC Law Ethics Professor Emeritus, says in the states where death with dignity is allowed, there have not been any reported cases of abuse. Barron sees a shift in sentiment as of late.
Principal opponents to legalization are the medical profession itself, although that's changing gradually. Secondly, there are religious reasons for opposing. And by the way, I think it's extraordinarily important that there be people opposed to this so that the arguments are well aired and we don't stumble into something we're sorry about afterward.
Barron points out doctors have always had ways of working around the law.
Physicians are, in fact, prescribing a month's worth of painkiller to patients who are terminally ill by saying, I want to warn you, if you take all of those pills at one time, it will kill you. Wink, wink, nudge, nudge. So this sort of thing goes on all the time. When it's discovered, for the most part, it does not get prosecuted. But you never know.
A wink and a nod is not how Dr. Roger Kliegler treated his patients. But what will he do when it's his time? And back to Dr. Rocket. She says she worries that states will start looking at the financial incentives to aid in dying. She cites an article from a medical journal reporting the potential savings in long-term care and hospitalizations for states that have right-to-die laws. She says this is precisely the wrong way these decisions should be made. Up next, this is what makes Roger Kliegler smile.
I may get to actually know her. She may actually get to know me and be able to remember me.
A new granddaughter.
There is no law stating that it is illegal for medical aid in dying.
Tonight, Roger Kliegler is in Falmouth at a meeting of the Death Cafe. Yes, you heard that right. Death Cafe. Heather Massey is co-founder of the organization's Cape Cod chapter.
It's an international movement. It is facilitating a place for people to come together and just talk about any aspect of death, dying, bereavement, in a non-judgmental, safe, comfortable place, because there is no place in our culture where you can do so.
Massey hopes that talking about death will help people to prepare for their own death or that of a loved one.
People go into retirement and they plan for 40 years. People die and they haven't thought about it at all and dealt with it and tried to make the decisions that they need to make.
Physician-assisted suicide is not something that we're promoting in terms of Death Cafe, but it is a subject that comes up a lot because many people wish they had more options and choices and or have really difficult stories to share.
Anthropologist Anita Honig teaches a death and dying class at Brandeis University.
My studies in that field really attuned me to the fact that our own relationship to death and a general culture of death avoidance have really had some unintended consequences in ways where people don't feel like this is something they can bring up, and where there are also specific ways in which death has been medicalized that make it really hard for people to choose other options at the end of life. Because there's this idea that you have to absolutely do everything in order to save somebody from dying.
For now, Roger Kliegler spends his time doing the things he loves.
I work for the Senior Environmental Corps, monitoring herring and horseshoe crabs and osprey and piping plover. They're an endangered species.
Kliegler's doctor decided to try one more treatment, Provenge, an immunotherapy drug. The results?
For whatever reason, my cancer is getting better, which is pretty cool because I have my first granddaughter. I may get to actually know her. She may actually get to know me and be able to remember me. There are lots of things I'd love to teach her and to share with her and all the wonderful things in life. I take life a day at a time, and that's what I consider important. I know at some point, I'll get sicker and not be able to do things, but for now I can.
Kliegler's wife, Kathy, an attorney, is hoping the courts will decide in her husband's favor, and soon.
So if the lawsuit prevails, how do you think you would handle that moment?
I hope it can be the way he wants it to be. I'll do whatever he wants, whenever he wants.
Do you hope or think that the lawsuit will be resolved in time for you?
I don't know what my time frame is now. The doctors can't tell me. You know, I've kind of fallen off the curve in a good way, so I'm really pleased about that part. Usually the lawsuit ends up being decided, and it's not about the person bringing the lawsuit, it's for other people. A third of people who end up getting prescriptions for this, for medical aid in dying, never take it. And you know, they just die naturally. But it relieves their anxiety. It gives people an option if they're suffering.
At this point, Kliegler can't predict the choice he will make.
I don't know that I'd ever take medical aid in dying. The things that I see in life still amaze me. You know, I'm not closing down, I'm not narrowing things down, I'm just enjoying life and living life. I don't want to die.
And we spoke with Roger Kliegler today, and unfortunately, his cancer is no longer improving. He is still hopeful, still walking 9 miles a day and trying to enjoy every day. Just last weekend, he danced at his daughter's wedding. That's Chronicle for tonight. I'm Anthony Everett. We'll see you tomorrow.